Paul Byrne, Chief Operations Officer with Healthcare Abroad, Ireland's leading cross-border healthcare facilitator, joins me now on the line. Good morning, Paul, and thanks for taking our call. Close to 900,000 people are currently waiting for outpatient appointments, tests or procedures. Just before we delve into kind of the option of accessing treatment abroad, what kind of impact is this having on people's lives here in Ireland, waiting so long for these often necessary and vital appointments?
Good morning, Hannah, and listen, thanks for having us on. Yes, the biggest issue here obviously is that the amount of people that are on waiting lists. However, there is a solution for people. Now, again, not enough people know about this. We do have our own reps on the road going out and educating people, and obviously any sort of media we can do will help. There is a scheme there that the European Union have. It's called the EU Cross Border Directive, okay? And what that more or less says is that any person, either on the private or public list, but it's generally public patients who access this scheme, but they're entitled, once they've lived in Ireland for 12 months and have a PPS number, they're entitled to leave the Irish healthcare system and travel within the European Union to a private health setting and have their surgery carried out. But also, not only can they have it carried out, once they have to pay for the surgery up front themselves, and then the HSE will refund them. Generally, in most cases, 94, 96% of all surgeries is 100% refunded. So again, not to confuse people with that. For the likes of hips, knees, so any orthopedic surgeries are all 100% refunded. Bariatric surgery as well. Same for neurosurgery, so back surgery, but also for the likes of gallbladders and hernias and bunions. So any procedure that's available on the Irish health system is also available in this scheme. Okay, what we do, Healthcare Abroad is our company. We're a private company, and we sit between the HSE and the patient, and we generally do everything for that patient. The only thing the patient has to do themselves is, one, they have to book their own flights. Secondly, they will have to have the funds in place to pay the hospital when they arrive in Spain, okay? And also I must give huge credit to the credit unions around the country, because the credit unions are great for offering loans to our patients because they know they're going to get it back from the HSE, and that usually takes about 16 weeks for the HSE to refund them. We do all the paperwork to the HSE for the patient, okay? So again, we take that stress and headache away from the patient. We also do and organise cheap hotels for people to stay in. Now, when I say cheap, they're 4-star hotels, they're fine hotels, but we get them from anything from €90 per night for 2 people, including breakfast, up to €120 per night for 2 people, including breakfast. We also do all the logistics, so we'll pick people up at the airport, we'll bring them from the airport to the hospital, we'll organise everything in the hospital for them, from their consultation, their pre-ops, their surgery. And again, the majority of our hospitals are in Spain, and the reason why we go to Spain is because Spain is number 3 in Europe as a healthcare system and number 7 in the world. So it's a really top-class healthcare system. But you will also do your aftercare there. So if you're going for a knee or a hip operation, you will also do 10 physiotherapy sessions in the hospital where you've had your surgery. So it's hugely beneficial to patients' recovery.
It just seems like something that people aren't really aware of. We know how long these waiting lists are, and unfortunately a lot of people now in recent years have just gotten used to waiting that long to get these procedures done. We have spoken to listeners in the past who have gone to the likes of up north for getting treatments and abroad just because of how waiting lists are so long at the moment here. In terms of once treatment is completed abroad, you mentioned there the likes of like knees or hips, physio is follow-up, 10 follow-up sessions are included. In terms of other procedures people might get abroad, would that same follow-up care be coordinated either abroad in the likes of Spain or back here in Ireland?
Yeah, so you're sort of covered. And look, it's a very common question. And also, like you said, we are generally, Irish people are so used to sort of banging their head off the walls or worrying or waiting to try and get people, get our surgeries. And there's no need for it. Look, it's not for everyone. Not everyone will be able to travel or want to travel. But if we can get as many as we can to travel, what that will do will reduce the actual waiting list, and hopefully the people that can't travel will then get their care here in Ireland. Okay, so it's an option for people, and that's what people have to realise. And most people that talk to us will say, it's too good to be true. Where's the catch? Because they're so used to, fighting and battling to get the healthcare. There's no catch. There's no cost From our point of view as a private company, we don't charge the patient any money for our services because we represent 87 private hospitals across Europe. So we have hospitals in Barcelona, Madrid, Valencia, Alicante, Denia, and they're all different hubs. So we'll have an orthopedic hub, bariatric hub, cardiovascular hub. So we have people on the ground there that will pick people up, as I said, and we'll have everything organised for them. So people always think there's a catch, but there's not. And that's why we are trying to spread the word. We do some road shows. We have gone around to GPs clinics to educate the GPs, obviously, because they're the cohort of people that need this care, sit in front of the GPs once a week or once a month. From the point of view of aftercare, because you're travelling within Europe and because this scheme is running and cared for from the HSE, you never actually leave the care of the HSE. So it'd be very, very simple as if someone was from Cork and they were travelling to Galway to have their surgery, that's out of county. They still remain under the care of the HSE. Under this scheme, they're travelling to Spain, that's out of country, but you're remaining within the EEC, so part of the European Union, so you still remain under the care of the HSE. Okay? On the backside of that, it's like if you have your surgery and you come out of hospital and you've an issue, you're nearly covered better if you travel with us, because one, you can go back to your GP here in Ireland, your GP can look after you, or your GP can send you to the hospital here in Ireland, to an emergency department if required. But we also are there. We don't disappear. So if we have issues or if a patient has issues, they come back to us. If it's a case we can get them fixed here in Ireland, we will. If it's a case where we have to bring them back over to Spain, we also will do that. It rarely happens. I mean, the infection rates are so low in Spain because the hospitals are so clean, and they're unbelievable. They are 5-star hospitals. They are private hospitals, but they're phenomenal. Most of them are new builds as well. So your aftercare is covered, on all fronts. We'll never disappear. We'll always be there for a patient to help them out, but they also still always remain within the Irish healthcare system.
Some people may be asking that, do they have to be maybe on a waiting list for an appointment or a procedure for a certain amount of time, or can they just go directly to the likes of healthcare abroad to look for the EU Cross Border Healthcare Directive?
Yeah, a very good question, and that's a huge misconception out there. People always think, you need to be on the waiting list for 6 months, or you need to be on the waiting list for a year. You do not. I want to make that very clear for people. It's as simple as a GP referral letter. So in other words, your GP, if he was referring you to a hospital, at the Maryland in Galway or the Wexford General Hospital, he can similarly refer you to a hospital anywhere in Europe. But if the patients contact us, we will contact their GP, because we will engage with their GP. We want to give as much information to our surgeon before our patient books their flights, okay? So when they contact us, we'll go through the scheme with them. We will then contact their GP. We'll get a referral letter from the GP. We will also get, scans, images, any medication that a patient might be on. As much information as we can, we will get that from the GP. We will share that with their surgeon, their consultant surgeon in Spain, before they book their flight. We will always tell a patient what they require, how much it's going to cost, how much they're getting back before they even book their flight. So no, you don't have to put your hand in your pocket even to find out what your situation is, what it's going to cost you, and where you need to go. So we contact the GP, we get the referral letter, because obviously we give all the correct information to the GP, as in what surgeon, what hospital, and that has to be spot on, because obviously we're going to do all the paperwork back to the HSE, and that information has to be correct. So obviously we know what we're doing. We're moving between 40 and 50 patients per week, so we know how the HSE like their paperwork back into them.
Lastly, Paul, I would ask, do you see this cross-border care as a stopgap, or is this part of a longer-term strategy that Ireland just will have to implement to address the chronic waiting lists here? Is this something that people may have to get used to, and it may become a major thing of considering abroad treatment?
Yeah, to be honest with you, 100% yes. And you might laugh at this. This scheme was first operated in 2014. This is not a new scheme. It has been there since 2014. And yes, Irish patients will have to. This is the way forward. This scheme was set up for all European countries, because public healthcare in all European countries is, I wouldn't say all of them are in the toilet, but under pressure. So they needed a way how they can reduce these waiting lists for people, and this is what the European Union came up with. And that's why you have to move out of your home country. People ask me, why can't I just go to a private hospital in Ireland? We have a 2-tier health system in Ireland. We have a private and a public, okay? If all the public people start going to the private hospitals, then all the people that were paying their private health insurance will stop paying, because they would say, well, why am I paying this? Okay, so you need to have the 2-tier health system. So that's what the European Union came up with. Okay, we'll take the public patients from the home country, we say for ourselves as the HSE, and we'll move them into a private section. So we do have Europeans coming to Ireland here to have their care here as well in the private hospitals. Again, what we need to think, and I think Irish people forget that we're part of Europe. You'll hear the politicians talk about Europe all the time, but the man in the street, the layman, don't really realise that we're an island on the west coast of Europe. We need to look at it like even the States of America. Like all the States of America are like the States of Europe, okay? But it's one country, and we need to remember that. And that's how to utilise the scheme. We are all Europeans. You're entitled, as a European, to get your healthcare outside your home country. The HSE have another way of saying it. They would say, if you look out the front window of your house, you'll see all the hospitals in Ireland that are available for you to use. If you look out the back window of your house, you're looking into Europe, and you're looking at all the hospitals that are available to you as a patient to go to in Europe. It's simple, but it's effective. That's the way of looking at it.
Lastly, Paul, for anyone who is considering now listening to this, looking into that EU Cross Border Healthcare Directive, where can they find more information and, of course, get in touch with yourselves at Healthcare Abroad?
Yeah, so you'll find us on all platforms. Obviously, we're on all social media, but also if they just give us a call on 01 267 8011, or go onto our website www.healthcareabroad.ie. All the information that you require is there. Explanations, the steps. All our hospitals are there, all our surgeons are there, and we actually have quite a few of our past patient stories, which will give people a great idea of how we look after our patients. So give us a call or look on the website, or you'll find us. You can direct messages on Facebook or whatever the case may be, but also a chat line there on our website as well.
That was Paul Byrne, Chief Operations Officer at Healthcare Abroad.